CFUW recognizes that we are indebted to First Nations, Inuit and Métis peoples, past, present and future, and pay respect to them as we gather as guests across the land, air and sea in what is now known as Canada. Please share the land from which you are calling in the chat. However, we also recognize that land acknowledgements are merely starting points in the journey of reconciliation and must also be accompanied by meaningful action to redress past and ongoing forms of colonialism. I'd now like to pass the webinar over to Sheila Service, lead of our CFUW National Study Group on Elder Rights and Long-Term Care, to set the scene for our discussion and to introduce our event co-sponsors. Thank you. Sheila, over to you.
Thank you, Catherine. Good morning, everyone. It's my great pleasure to welcome you today. The CFUW has been taking a very great interest in seniors even before COVID hit, but certainly after COVID became a major problem. It became apparent with long-term care and elders living alone that there were serious gaps in our care for them. So this is a national group that has gotten together and has been working on seniors issues for the past 2.5 years. So we are welcoming today Margaret Gillis, a founding president of International Longevity Centre Canada, Kahir Lalji, Kahir, MA GPG, Provincial Director, Government Relations and Programs, United Way, British Columbia, Bobbi Symes, MA CPG, Assistant Director, Population Health, United Way, British Columbia, and Elizabeth Siegel, Director, Information and Referral Services, Seniors Newfoundland. And we will get into them presently, but we also want to acknowledge that we are pleased with the generous support of our partners and co-sponsors of this event, Canadian Health Coalition Organization Long-Term Care Advocacy Overview. Pat Horn is the board member who we've been in contact with. HelpAge Ontario Health Coalition Overview. Natalie Mahira is the executive director of that group. And with us today from HelpAge Canada organization, Seniors Programming Overview, is Gregor Snedden, the executive director of that group. I'm going to turn it over to Gregor to make a few comments, please.
Thank you very much. It's a privilege to be here with you today. I'm just thrilled to hear from Charlotte to participate in supporting this great event today. The Canadian Federation of University Women does amazing work, and I'm particularly impressed by their strong advocacy for the continuum of care and really working for the rights of older people, particularly around their care options that are always made available and accessible and are needs-based, which is so important to understand the needs of older people in Canada. Now, HelpAge Canada, we support community-based initiatives across Canada and abroad to improve the lives of older people. And in Canada, we work with underserved older Canadians, low-income older Canadians, and so on. We, interestingly enough, are one of the facts that the Canadian Federation of University Women point out is that 78% of older people prefer to age in place. And HelpAge Canada, we're involved right now in one of the leading organizations in the humanitarian response for Ukraine. And in our recent analysis, 99% of older people in Ukraine, even in the east of Ukraine, prefer to stay at home, prefer to age in place. They don't want to leave, even under these circumstances, which really speaks to the importance of agency, of voice and autonomy for people to choose where they want to live in their communities and with the people that they want to age with. HelpAge Canada, part of aging at home is important to our work, and in our 3 flagship Canadian programs really addresses aging at home. we really have a focus on social inclusion. So we have a granting program called Seniors Can, where we provide micro grants for mobility and communications devices. That could include bed lifts, toilet seat raises, safety bars, door widening, walkers, hearing aids, even teeth, to be able to engage and participate in community life, as well as grants for innovative programs that address isolation and loneliness. Age-friendly transportation is huge. We know that transportation is now considered to be one of the social determinants of health. 42% of senior non-drivers say they have unmet needs in regards to transportation. 37% suggest that they experience social isolation because they don't have accessible transportation. 65% have fewer trips to family, fewer trips to the doctor, fewer trips to shopping and finding the food that they need to eat. So aging at home is critical that we have a robust and accessible transportation availability for older people in Canada. So we've launched this program called Fast Track, where we did a national and an international scan, and we're identifying Canadian solutions that can easily be scalable and repeatable across Canada. And finally, to age at home, following out of the pandemic, where we were Canada's first primary responder to older people in Canada, low-income older people in Canada, with humanitarian relief. When the federal government stepped in through their partners, we were able to shift and pivot, and we really identified that isolation and loneliness of older people, they really needed support in digital literacy. So we have a number of programs. Right now, we have a pan-Canadian program called Dig It, where we provide low-income older people with tablets and age-friendly digital literacy training through mentors and volunteers. We work with United Way of British Columbia and their amazing digital literacy program for older Canadians. And we also have a program in Nunavut, an intergenerational program bringing together Inuit youth and elders throughout rural Nunavut, providing tablets and age-friendly and culturally appropriate learning for older people to stay connected, to visit their doctors, to get the care they need, to connect with family, friends, and even some really cool northern apps. Like there's an app that identifies the depth of the ice at the flow edge where the hunting happens from a satellite, which is kind of a cool innovation for elders to use in their communities. So we're very excited to be here and to support this event today. And I hope this little snapshot of what HelpAge Canada does in supporting older Canadians and allowing them to live at home and to really embrace that continuum of care that the Canadian Federation of University Women are so strong in promoting. So thank you very much. And I'm really excited to hear from our excellent panelists today.
Thank you so much, Gregor. And I understand that Pat Van Horn from the Canadian Health Coalition organization, Long-Term Care Advocacy Overview, has joined us. So I would like to invite Pat to speak briefly on her organization and its aims, if she would, please.
Thanks. I just want to say that that long-term care is something that the Health Coalition has been deeply involved in, certainly since the beginning of the pandemic, and and overall the origins of the Canadian Health Coalition was to protect the Canada Health Act and to make sure that the things that ought to be included in the Canada Health Act are there. Long-term care is not one of those things. Long-term care remains in the marketplace. And we know for sure that that private long-term care is not as suitable to elderly people as the public sector, and those things need to change. That's not going to happen overnight. And we know, for example, in Ontario, where I am, that the current government in this province is much more leaning towards the private sector in terms of providing long-term care, which is just unacceptable over the long term. We need to, because, and I'm one of those people, I'm in the demographic that may well end up in long-term care over the next few years, and I sure don't want to end up in the private system. So we were part of the we have submitted briefs to the current study on the long-term care standards, which we hope will become an official and federal standard that will be applied across the country. And I have to tell you that I'm old enough to have been involved with the Canadian Union of Public Employees back in the 1970s, when we had a campaign that was called End the National Shame. And the End the National Shame meant to stop what was going on in long-term care then. And that, like I said, was in the 1970s, and we're still dealing with that now. So, the national shame continues, and we have to advocate on behalf of our seniors, that's me too, that need to have proper health care, and continuum. The continuum of care is extremely important over the period of our lives. And I think that a webinar like this is extremely important. If just to let you know, we do a weekly news blast, and often those news blasts involve statements on long-term care, and that's canadianhealth.ca. So keep in mind about that. The Health Coalition has a number of organizations, national organizations, and we also have, while they're affiliated to us, in a sense, the provincial health coalitions are doing their own work in each of the provinces and territories. The CHC focus is primarily to ensure that there is a national focus that melds with the focus of the Canada Health Act in a way that we can make this stuff a national, both standards and things that, and the kind of care that the Canadians can be sure of and count on as they age, whether that's in acute care in hospitals, and whether that's moving forward into care facilities. I can tell you that in my family, my mother lasted 11 months in long-term care, and died of a fall. My father lasted only a matter of days. So obviously the care is not there. Our seniors are not getting the care that they need. I agree with what Gregor said about aging in place. That's important. If that is something that can be worked on in a coordinated fashion with all organizations, including your own, I think that's very important. And I really appreciate this webinar happening at this time. I would hope that you would all connect in some way with the Canadian Health Coalition, and we make this truly a national campaign. Thank you very much.
Thank you very much. I'm going to turn it over to Charlotte briefly to just make a few comments.
Thanks so much. We were also lucky to partner with the Ontario Health Coalition as well on this event, and I'm going to read some of their remarks just to frame the discussion. So, more than 4,500 residents in long-term care have died of COVID-19 alone. That does not capture what must surely be thousands of others who died as a result of horrific negligence, yet care levels have not improved. There has been no accountability. Comprehensive surprise inspections have not been reinstated, and not one single long-term care home operator has been fined or lost their license, not even the very worst of the for-profit corporations responsible for the deaths of thousands of frail elderly residents in their care. Now the government is midway through giving more than 18,000, this is the provincial government, beds by public dollars to the same for-profit change in 30-year licenses. The suffering in long-term care requires an unequivocal commitment to say never again. The Ontario Health Coalition's long-term care priorities ahead of the election are that all political parties must commit to a minimum requirement of 4 hours of care per resident per day in each and every long-term care home. It is not acceptable that this is not an unenforceable average province-wide. Secondly, reinstate the comprehensive inspections that were canceled by the current government and conduct a surprise inspection of every home within 1 year. Third, hold operators responsible for egregious negligence and non-compliance, including meaningful fine, revocation of licenses, and criminal charges where warranted. Lastly, recognize and respect and uphold the human rights of residents, including the right to have family caregivers, the right to consent to care, and the right to be treated with dignity and quality. So at CFUW, we join other advocates around the world and across Canada who believe that a different way for older people is possible. Human rights should not have an expiry date. We believe that a continuum of care approach to aging will expand the rights and dignity of older people. Continuum of care is used to describe an approach of bundled care options that follow an individual throughout their lives, adapting to their changing needs, and refers to the care from one receives from birth onward, including hospitals, urgent care, public health services, long-term care homes, and so on. From support with daily tasks to age in place and live independently, to more specialized care, the continuum of care model meets seniors where they're at and help charts a course for where they want to go. We're taking action to ensure that the rights of older people are invisible no more, and are working with partners to promote services and programs to help older people age with dignity, care, and respect. So I'll pass it back over to Sheila to introduce our esteemed panelists.
Thank you, Charlotte. I just want to let the people that have joined us know that we are planning a 2-hour session today. If you have questions that arise during any one of the speakers' comments, please put them in the chat, which will be monitored. And when we get to the question and answer period, we will go straight to the questions in the chat from you rather than having them come formally from me. With that said, it's my great pleasure to introduce Margaret Gillis. She's based in Ottawa, Canada. She is the founding president of the International Longevity Centre Canada, human rights-based organization, and she is co-president of the 16-country International Longevity Centre Global Alliance, dedicated to the needs of older people. An award-winning executive and innovative leader, Margaret has played a key role in establishing the age-friendly community program in Canada and globally, and an international partnership to protect seniors in disasters. Margaret also serves as chair of the National Advocacy Working Group at the Global Alliance on the Rights of Older Persons, and is working to establish a United Nations Convention on the Rights of Older Persons. With a background of health promotion, production, and programming, Margaret is committed to improving the rights of older people. Welcome, Margaret.
Thank you.
To you.
Thank you very much. On our theme, Invisible No More, I want to start with invisibility and move to clarity and blatant truth by examining how human rights were impacted and how they impacted the continuum of care, particularly during the pandemic. Now, I want you to imagine for a minute if your life situation was described as terror awakened, devastating, broken-spirited, and muzzled and trapped. Or better yet, imagine a scene where people were lying on mattresses, soaked in urine and vomit, dying from preventable dehydration, or choking without medical aid as carers waited in horror for personal protection equipment. Imagine being barred from hospitals, all in war zone conditions. Does this sound like human rights abuses to you? Think about the right to life, the right to health, the right to care, support, and independence. all of them the continuum of care, and also cornerstones of our democracy. Sadly, these heart-wrenching words were spoken by frail older Canadians and their carers, not in some faraway zone, but in Canada's long-term care homes. These quotes were from residents of Hamilton and Toronto. So think of it, dying of malnutrition and dehydration in some of the richest cities in one of the richest countries in the world, our country. These events have clearly illustrated the fragility of human rights. We all witnessed it in every country, rich and poor, north and south. There was horrific death and suffering, and none felt it so severely as older people. Our session today gives us an opportunity to look at how we could have done a better job in protecting the human rights of older people by taking stock and reflecting on the carnage we just witnessed and the measures we need to ensure it never happens again. This means shining a light on the invisible. And I may add here how thrilled I am to be asked by CFUW to speak on these issues, because I am regularly asked to speak to groups whose main focus is aging issues, which is great, of course. But this is a community issue, a social justice issue, and it needs to be owned by all of us. Now, by just about every objective standard, Canada is one of the best countries in the world to live in. Rich with the universal healthcare system, a strong social safety net, a country with access to all the best determinants of health. Yet in my 63 years on the planet, I can't recall a time when our country was less recognizable, when the principles that Canadians have been raised to take for granted, the right to life, the right to health, the right to care, support, and independent living, were so profoundly denied, based on age, and rooted in ageism. In other words, how in the world could the following have happened in Canada? We saw the right to life and the right to health of older people completely abandoned. This is exemplified by those living in long-term care, where 80% of the deaths occurred in the first two waves of the pandemic. We all know what happened. A situation so bad that the Canadian Army had to go in, and their resulting report so horrific, it was hard to read, much less fathom. We saw older people denied the right to health, and those living in long-term care homes were barred from hospitals and left to die unaided by COVID. Moreover, governments instituted ageist triage protocols, like the one we heard about in the province of Alberta, that denied healthcare to those over 60. We also saw the lack of protection of older persons' rights in relation to care and support systems. Lockdown measures, including in some cases the suspension or scaling back of care and support services, meant older people were unable to get the care and support they needed in their homes or in their communities. So in a year when older people were disproportionately devastated by the pandemic, we would have expected a more robust response from governments in Canada and frankly around the world. Instead, civil society witnessed a stunning indifference to the human rights of older people, an indifference that allowed us to ignore the anguish experienced by older people, rendering the lives of those suffering as meaningless and frankly invisible. This is ageism in its purest sense: immoral, reprehensible, harmful, and deadly to the life and security of the old. We as civil society and as human beings need to expose this ageist indifference that led to these events and demand that it not happen again. So let's talk about the issues that led us to this place. And then I want to look at one tool to respond. Now, as mentioned, my organization, the International Longevity Centre of Canada, is a human rights-based organization, and we're part of a 16-country global alliance. We are committed to battling ageism in all its forms. And indeed, our founder, Dr. Robert Butler, coined the term ageism back in 1969. Now, the last 2 years has been a magnifying glass on ageism. Like no other time in history, the last 2 years has illustrated the need for a human rights response to ensure older people are treated equally. And the issues that arose in the continuum of care make that abundantly clear. And do not kid yourself. What you witnessed in the last 2 years was a wholesale attack on the human rights of older people. So I'm going to advocate that we have a great opportunity here to respond to rampant ageism and invisibility in a most compassionate way, a way that will uphold the human rights of older people through, among other things, a demand that long-term care and the continuum of care be addressed with approaches that reflect the needs and the wants of older people. And some of our earlier speakers talked about how older people prefer to stay at home. So I'm going to suggest that we support a United Nations Convention on the Rights of Older Persons. Now, a United Nations Convention is a legally binding document signed by member states of the United Nations, which sets out in detail the rights each country must bestow on its citizens. Think of it as a separate set of laws that protect older persons' rights internationally. We know a number of other groups have the protection of a UN convention, such as women, children, and persons with disabilities. Yet we do not have a convention on the rights of older persons, like there are for women, children, and persons with disabilities. And the pandemic has shown us that we need one, and we need one now. So I want to take a quick moment to tell you how a convention would support the rights of older persons. In general, a convention is a method of achieving positive change by combating ageism, guiding policymaking, and improving accountability of governments at all levels, which we most certainly need. A convention would also educate and empower, and would see older people as rights holders with binding protections under international law. But let's take a closer look at what could have been done for older people in the past 2 years by examining some of the examples of how older persons' rights with the continuum of care have been violated and how a convention could help. In Canada, the Charter of Rights and Freedoms, Section 7, notes that everyone has the right to life, liberty, and security of the person, and the right to not to be deprived thereof. Yet older people's rights to security was denied during the pandemic. As we know, older people were left to die unaided in care homes. And despite years of warning and report after report stating that long-term care system was inadequate, nothing was done. And let's not forget, prior to the pandemic, the press was full of stories of elder abuse in institutional care, and nothing was done. So when the pandemic hit, it was a perfect storm for the large-scale deaths of frail older persons evidenced in Canada. Disgracefully, Canada having the worst death in long-term care of all OECD countries, although quite frankly, they were all awful. So what could a convention have done? Well, it would have seen older people as rights holders, equally valued, whatever their age, and would lead to a situation where adequate policies and supports for older persons requiring care would have been realized. This means measures would have been in place to make long-term care a safe and healthy place for older people. As well, we need to look at the continuum of care approach that allows people to stay in their homes as long as possible, which is their right and their want. Now, we know older people were denied access to hospitals and then left to die of COVID unaided. How horrible is it to think that those who brought universal health care to this country were denied access when they needed it most? As COVID cases and anti-vax sentiments rose, the Alberta healthcare system was on the verge of collapsing. You all recall the coverage of that. So what did the Alberta government do? It released a triage protocol that stated people over 60 with a poor chance of survival could be denied access to intensive care units. So older people pay with their lives for the poor choices of governments and ill-informed citizens. These ageist health triage protocols put older people at risk, diminishing their right to life by naming them as a group who would be denied care. Imagine if that had happened to any other race, religion, color, or creed. So what would a convention have done for older people in this situation? Well, it would have guaranteed the right to access to Canada's universal health care coverage. In other words, in future pandemics, people would not be denied access to health care because of their age. Now, those of us working in the field of aging know that Canada has underfunded both long-term care and home care, key parts of the continuum of care. The underfunded home care has several human rights impacts. It stops older persons from having the right to choose where they live, sometimes forcing them into care prematurely. And it takes away their autonomy and the right to live where they choose. In some cases, COVID-19 emergency measures reduced access to care and support measures. And we know there were limited or no options for people to go. We have long wait lists for long-term care even before the pandemic. Imagine needing to access one in the middle of the pandemic. So what would a convention have done? Well, it would have recognized that care and support are fundamental rights, and that all of us may need at different times in our lives. And it would result in care and support systems that actively promote independence and enable us to live independently in the community when we're older. It would evaluate the importance of care and support services and ensure we are treated with the same seriousness as other services, such as healthcare. Better monitoring and rights-based regulations would be developed and implemented, and additional resources allocated. More and better quality care and support service provided in-home and community services, including, for example, training and better conditions for caregivers, would support older persons' right to choose where and with whom they live. Older persons would lead more independent lives, participating in their communities without the heightened risk of institutionalization. So where are we in terms of the convention? In May 2020, the Secretary General of the United Nations wrote a very important policy brief on the impact of COVID-19 on older persons around the world. I'm proud to say that Canada was instrumental in getting 147 countries to sign on and support this document, which called for the need for stronger legal framework at international levels to protect the rights of older persons. Unfortunately, and on the other hand, Canada and many other countries still are not supporting the convention, despite clear evidence of the need. That said, there is some hope. 2 weeks ago, at the United Nations Open-Ended Working Group on Aging, which is the annual UN meeting where the rights of older persons are discussed and addressed, a number of member states met to discuss how to move forward to protect the rights of older persons. Canada hosted a meeting of like-minded states, and they have decided to continue to meet and look at options on how to improve the rights of older persons. Baby steps, but a beginning. We all need to learn and grow from the treatment of older people in the pandemic in Canada and elsewhere in the world. We just must demand that Canada and other member states of the United Nations continue a history of empathy and support for human rights as they have for other groups who have faced prejudice, neglect, and provide those same protections to older persons. So what can we as civil society do? Well, to quote the great Maya Angelou, we need to be angry, and you need to take that anger and write it, talk it, march it, and vote it. We should be furious about the rights violations we have seen. Talk about rights for older persons. Talk about the right to life, the right to health, the right to care, support, and independent living. Explain the need for a human rights-based approach through a convention. As a member organization of the Global Alliance for the Rights of Older Persons, ILC Canada is proud to support the Age with Rights campaign, raising awareness and mobilizing grassroots support for UN Convention in countries around the world. Look at our ILC's recent UN Open-Ended Working Group side event called Older Women Rock the World, the right to participation and those who make it happen. We had a terrific lineup of speakers, including Ambassador Bob Ray, the Right Honorable Adrienne Clarkson, and the United Nations independent expert on the enjoyment of all human rights of older persons, Dr. Claudia Mahler. We actually had some welcoming remarks from the Honorable Kamel Kira, Minister for Seniors for Canada, the day after she addressed the General Assembly at the United Nations. And this is the first time a Canadian minister has had a presence at the Open-Ended Working Group on Aging, a sign that the government's at least paying attention to some of the human rights of older persons. But really interestingly, Ambassador Ray noted in our session that what happened to older people in nursing homes in Canada and around the world would never have happened to any other group, and that we need to speak to the humanity of the whole aging process. Well, we certainly agree. We certainly need more action. And I hope you'll join us in demanding a convention and supporting the call for real compassionate change to address the continuum of care and in the full treatment of older Canadians. Think again of older people impacted by COVID-19. Each one of them had the right to life, the right to health, the right to care, support, and to independent living. One thing the last 2 years has taught us is that we need societal change. That demands all of us, government, civil society, and citizens. We need to come together and celebrate and respect the gift of longevity. Thank you.
Thank you very much. Powerful. I would like now to introduce Kahir Lalji, United Way, British Columbia. Kahir is a community champion and nonprofit leader. Inspired by caring for his grandparents, Kahir dedicated the last 15 plus years of his life to supporting the quality of life of adults. always attempting to ensure the representation of traditionally underserved populations. He is the Provincial Director, Government Relations and Programs with the United Way, British Columbia, working with communities in BC's interior, Lower Mainland, and Central and North Vancouver Island, and was the Executive Director of the United Way, Southern Interior BC. He's also a gerontologist with a master's in gerontology from Simon Fraser, and also has a fellowship in developmental leadership and evaluation. He is on the advisory board of Aging 2.0, the president of the board of directors for British Columbia Original Minds Association, and also serves on the board of directors for HelpAge Canada and BC 211, and is a member of the Aga Khan Health Board for Canada. Bobbi Symes is the Assistant Director of Population Health, United Way, British Columbia. She works with communities in BC's interior, Lower Mainland, Central and Northern Vancouver Island. She is the Assistant Director, Population Health at United Way of British Columbia, working with communities in BC's interior, Lower Mainland, Central and Northern Vancouver Island. Bobbi's portfolio includes overseeing the implementation and evaluation of the population health department programs. Bobbi has extensive experience in research and program management, specializing in the areas of population health, injury prevention, and older adults. Welcome to both of you.
Thank you very much for that introduction. At the outset, I just want to acknowledge the organizers and my colleagues who are co-presenting for the work and the time on this incredibly important topic. Look, we've heard from Margaret around the need to look at rights of older people. We also know that from our conversations, people want to age at home and have a right to age at home if they so wished to do so. So that I would suggest is not new. What we are intending to do in the next few minutes is to talk about the role community can play if supported adequately in supporting older people to remain at home if they so desire to do so, and also have the ability to choose the services that are important to them, that they need to age in place in a way that's healthy and safe for them. So really looking at the concept of a person-centered approach. You'll hear me speak around a concept here in BC known as the Community-Based Senior Services Sector, or CBSS, which refers to hundreds of partners, community-based organizations who take a grassroots community-based approach to getting to know older people and their family, friends, and caregivers in their communities, and providing person-centered approaches so that older people in their hyper-local communities have the resources and supports that they require to be safe and healthy at home. On the next slide, I just want to acknowledge that we work throughout the province of British Columbia. We work with over 700 nonprofits that collectively reside and gather on unceded ancestral territories, of which we are grateful and pay homage to for being able to work, gather, and live on our collective unceded and ancestral territories across the province and across our country. So when we talk about healthy aging, what do we need? So healthy aging really is the way that we've looked at supporting British Columbia seniors to stay at home in their own communities for longer. On the next slide here, we'll see three key pillars to the work that we do, including building on the inherent assets and strengths that are already resident in local communities. We know that so many residents have the skills, the talents, and the treasures to be able to inform their own programmatic as well as needs that they require support in. And so we really look at an asset-based approach. We also support older adults to have greater control over their independence, health, and dignity. So the three key values that we do in our work is we support community-based organizations to keep older people active. We know physical immobility is a challenge, both to older people as well as to our systems that support older people. So what's important to know here is keeping active is really dependent on the individual person. Being active can mean today I moved from my bedroom to the kitchen and that was success. Being active could mean I was able to get out into my garden today. But active could also mean I was able to go for a walk, I was able to attend my local senior center, really being able to foster mobility and physical literacy amongst older people. To keep connected. And you know, there's some conversations around the difference between isolation and loneliness. And our work is centered on loneliness, the subjective feeling of being alone. We know in British Columbia, 1 in 4 older people don't have one person to talk to. Meaning, in the case of a crisis or an emergency, they don't have anybody in their support system that they can call upon. And so building vital connections is instrumental to the work that we do. And keeping older people engaged. We know there's profound thought leadership, both in existing cohorts of older people and what we anticipate coming in emerging cohorts of older people. So paying homage to and valuing the knowledge and the talent that all people can provide in supporting inclusive, healthy, caring communities. Our model uses a community development approach model where older people, their family, friends, and caregivers are the center of our approach. And in our humble opinion, that is the only way to support older people because they have a right to determine what supports and services they require to live their life in their home. We also know that people within community are surrounded by a larger community. We also know surrounding that community, we have a number of locally based community service providers that provide support as well as provide programs for those in community. In British Columbia, United Way British Columbia acts as a backbone to support those local community-based service providers, to support community, to support older people in their communities. And this is supported provincially by funding, by policies, as well as ensuring that we are addressing uneven supports of services in BC, and I would suggest Canada. We know underserved and underrepresented older people are disproportionately underserved in program and service delivery. Newcomers, those that identify as LGBTQ2SI, elders, those that may be deaf and hard of hearing, those that may be culturally blind, those that are displaced, are disproportionately impacted by things like poverty, social determinants of health, and as we've seen, climate injustices over this last year. We also know those that live in rural and remote communities are disproportionately isolated from the rest of the province or country. And so really meeting people at where they're at in terms of their psychosocial as well as their place that they decide to live in. And so we really value the community-driven model that's based on a person-centered approach. Over the course of the last couple of years, we've seen how older people have been disproportionately impacted by things like the pandemic, the heat wave where we had hundreds of preventable deaths in British Columbia. We've seen how older people were disproportionately impacted by fires and floods in British Columbia. And I'll share a couple of stories with you. I went into one small community that was on evacuation order as the fire was encroaching on that community. And as I met with the emergency services department of this particular community, I was looking at the evacuation protocols. And there were 2 assisted living facilities that did not have an evacuation protocol for older people residing in those assisted living facilities. We cannot forget about older people in our communities. We also saw how community-based nonprofits during the pandemic, during the heat dome, during the fires and floods, were able to make incredible efforts in calling and transporting older people to cooling stations, to reception sites, as well as providing transportation in and out of their communities. And we know that the role community organizations can play has tangible impacts on the lives of older people based on the decision and the needs of the older people to ask for those services. We have also seen through some of this work how healthcare utilization costs have, or utilization of healthcare services has declined based on older people receiving social support services in their communities. We also know the value of a person-centered approach in delaying forced relocation to living environments that they may wish not to move into. I just want to provide a quick example during the pandemic, how a coordinated network of 153 organizations came together to support older people who, again, were most significantly adversely impacted during the pandemic. By a coordinated community-based system, the next slide will indicate to you some of the services that were provided. Over 1.1 million services were provided to older people in British Columbia, things like delivery of prescription, things like delivery of food, things like just a friendly check-in to see how somebody's doing. And we know that that helped prevent further loneliness and further escalation of acute healthcare needs. And these are self-reported by older people just by having somebody to talk to. We also know through this particular program that we found we served an additional 600 older people that had no access to any supports prior to the pandemic. And so this begs the question, how many more older people are there that we are not aware about that are struggling to write to life issues in their own home? The last slide that I'm going to present on before my colleague Bobbi resumes the conversation here is I want to show this picture because the amount of times that I get told that if an older person requires resources, they need to move to a community that has those resources. They decide to live in risk. In my opinion, that's the furthest thing from the truth. We all, like them, want to live at home. Whether that's up north in a village of 298 or whether that's down south in a larger metropolitan area. It's important for us to take programs and services to where people are at to adequately meet the needs of people living in their homes, in their communities. And this can only be done if we have the programs and supports available for older people, their family, friends, and caregivers to self-select based on their own individual life circumstances.
Thank you, Kahir, for setting the stage and the foundation. And I'm going to now speak to you a little bit more about some of the programs and services that we offer funded through the provincial government, the Ministry of Health, but organized and offered through the United Way of British Columbia. The first one is often referred to as our flagship program. Better at Home helps older people with non-medical, simple day-to-day tasks so that older people can continue to live independently in their own homes. The typical basket of services that Better at Home offers can include things like friendly visiting, transportation, whether it's to a grocery store or to a medical appointment, light yard work, minor home repairs, light housekeeping,
grocery shopping, which through the pandemic was definitely increased substantially. And in some locations, depending upon where people live throughout the province, snow shoveling is also an extremely important service to deliver. Older people requiring these services can pick the ones that are most appropriate and important to them. Healthy Aging administers the Better at Home program throughout the province of BC, supporting over 85 nonprofit organizations who deliver Better at Home in over 260 communities across the province. This community-based approach ensures that local agencies are responding to local needs. And as you can see on this slide, Better at Home continues to grow and expand into new communities across the province of BC. And more recently, looking at expansion into places like Dease Lake and Terrace, Hudson's Hope, Fort Nelson. You can see those on the slide. I'm just going to play a little video for you.
My name's Gus Williams, and in First Nations, for me, it's like keeping the place clean, like dusting.
It means that I have energy to do the other things that make life worthwhile.
When I lost my driver's license, I was finding it very, very difficult to get around and do things. And when I heard about this organization, it sort of filled a gap that I really needed. It's only once a week, but it does get you out.
As you can imagine, it's so meaningful to actually get out there and talk and listen to the people that are being served by Better at Home. And that video was just a little snippet of that. So now I want to go into a couple of other programs that we have. So Better at Home was meeting an acquired need in community. However, we were very quick to identify through a series of provincial community consultations that there was a gap for services in the sector for what I'm going to call here higher needs or more vulnerable older adults who wanted, of course, to continue to live in their own homes. And the challenges that we are seeing providing programming appropriate for this population. The goal here was to address the gap by looking at some of the promising practices that were happening across the world and how we could more integrate programming strategies. Throughout the process, we identified 3 programs that we wanted to try here in BC. First was social prescribing, which was showing to have extremely positive results in the UK. Therapeutic activation programs for seniors, or TAPS, which was a program that was currently running in Creston and showing some really positive impacts in that community. And of course, family and friend caregiver supports. So first, social prescribing. I want to just identify that 80 to 90% of our health outcomes are driven by social determinants of health. And when I say that, I'm talking about things like housing, transportation, food security, income. For a person to thrive in health and well-being, they must have access to not only appropriate medical care, but also access to meaningful social supports in a community where they feel that they belong. We also know that 20% of patients consult their GP for what is primarily a social and not a medical issue. And here's where we looked at social prescribing. We found this model in the UK that used the term social prescribing as a way to better integrate clinical and social care. Social prescribing provides a pathway for doctors, nurses, and other health providers to formally prescribe patients to an individual to support them. We call these individuals community connectors, also referred to as link workers and navigators. The connector's job is to find a way to co-create improvements to health and well-being. The senior prescribed to the program typically works closely with that community connector for 6 to 8 weeks, helping to introduce them to community and community programs. And we've seen many connectors actually attend a first exercise or a first cooking class with the senior until they feel more comfortable to do this on their own. We've also seen individuals who no longer had the will to live become active, engaged members of society through this program. We have 19 community agencies in BC offering a social prescribing program, and we are starting to see unique ways that the community-based senior sector can work hand in hand with primary care, home and community care, and health authorities. Therapeutic activation programs for seniors, or TAPS, is a prevention-oriented program that's designed to support older adults who are homebound and to delay their use of health services. So things like adult daycare, assisted living, and complex care. The TAPS model, as I mentioned, was a TAPS wellness program located in Creston, and which supports isolated older adults who are experiencing barriers in accessing community resources. The program model has been identified as critical to address the significant service gap, and important both for older adults who are unable to access community-based senior services independently and who are not typically eligible for health authority adult daycare services, and provide their family caregivers with respite at the same time. There are 16 agencies in BC who are offering a Healthy Aging funded TAPS program, and program varies by community, but a typical session might include transportation to the center, followed by some light exercise, a shared learning opportunity through a workshop or a webinar, and a healthy meal with some equally nourishing conversation. These simple group activities are important for people who live alone, helping them stay connected and engaged. And then there's family and friend caregiver supports. So knowing that much of the work that we do in healthy aging is about enabling seniors to stay at home and in their community as long as possible, we also need to support the family and friends who make this happen. This program focuses on supporting family and friends who provide unpaid care to older adults still living in their homes, but require an extensive amount of care due to chronic disease, frailty, or life-limiting conditions. These programs aim to enhance caregiver emotional, mental well-being by increasing their skills, knowledge, confidence, and inclusion as partners in care. Service provided includes individualized and ongoing one-to-one emotional support, peer support, information and referral to community services, and access to education and coaching. We partner with the Family Caregivers of BC, who provides leadership to 17 agencies who deliver this program in BC. Family Caregivers of BC provides consultation, training, works with us on evaluation, ongoing collaboration to design, implement process that fit the needs of the individual communities. So all three of the programs that I just talked about, social prescribing, TAPS, and family and friend caregivers, are all currently being evaluated as part of a 3-year demonstration project. Some of the findings that were emerged during the most recent interim report include what you're seeing on the screen. We're seeing an increased access to social, physical, and nutritional supports, so meals and grocery delivery, improved physical and mental health, so important during the pandemic, but we actually saw continued participation in physical activity, even if it was on Zoom, or we could go outside, some walking groups or meetings in the park. And just really an improved ability to feel seen and heard. We saw an increased sense of social connectedness, again, such a huge target during COVID. We saw a connection to peers via conference calls and support groups, and this is all made possible through these programs. Upstream preventative nature of programs led to less medical issues being left unaddressed. And of course, one of the huge things that we saw, especially during the pandemic, was an improvement in quality of life, even during a pandemic. So some of the critical success factors that we just wanted to mention was that ensuring the success and sustainability of these programs and services as we continue to move forward is we want to assure appropriate resource allocation. All of these programs need continued support, which includes funding to remain sustainable. We're really looking at continuing to build the partnerships, especially around primary care providers and being partners in care. We want to also ensure that we're very conscientious of the time and effort that the community-based senior services put into these programs, and they're not there to just be downloaded on from healthcare providers. We want to ensure appropriate service distribution and that services are where they need to be. And of course, aligning the sector overall. So with that, I want to thank everyone for your time today.
Sheila, you're muted, sorry.
Yes, I'm sorry, rookie mistake. Thank you both, Kahir and Bobbi. We in Cowichan are certainly well aware of the kind of support that we get from you and appreciate it very much. So now I'd like to turn to Elizabeth Siegel. Elizabeth is Director of Information and Referral Services at Seniors Newfoundland. In this position, She manages Seniors Newfoundland's information line and the volunteers who assist, as well as the iCarol database system. Captures call. Sorry, I'm not sure if I got lost here.
Oh, you're all right, Sheila. Want me to take over the bio for you if you'd like?
No, it's okay. My screen went blank and I thought I'd lost the call. Sorry.
Oh, no, you're all good. Keep on going.
Fair enough, thanks. Sorry, so the iCarol database system, which captures call information and provides statistical information. Elizabeth has been involved with Seniors Newfoundland since 2004 when she helped develop the publication Looking Beyond the Hurt, a service provider's guide to elder abuse. Since that time, she's been involved in several other elder abuse initiatives and was the provincial coordinator of the Newfoundland and Labrador Network for Elder Abuse from 2012 to 2018. This is a network of community and government partners working together to prevent elder abuse and an integral part of Seniors Newfoundland's efforts to address elder abuse in their province. Elizabeth took on the role of Director of Information and Referral Services in 2015. She's very interested in seniors issues, ways to improve system navigation, and elder abuse prevention. Elizabeth is a certified information and referral specialist with the Alliance of Information and Referral System. So Elizabeth, over to you, please.
Hi, thank you for having me. So I'm going to talk about promoting the independence and well-being of older adults in Newfoundland and Labrador. So next slide, please. So in this presentation, I'm going to introduce SeniorsNL, tell you a little bit about what we're hearing from seniors and how we empower seniors through information and navigation, and the link between clear information and age-friendly communities. Next slide. So first, a bit about us. Our mission is to support, promote, and enhance the independence and well-being of older adults living in Newfoundland and Labrador. Next slide. And our mandate is to use information and referral to support informed decision-making. We also facilitate development and implementation of programs, and we work to influence policies affecting older adults. Next slide. So one of the main ways we do this is our seniors information line. We have a toll-free line that's available across the province, and it's open from 8:30 to 4:30 Monday to Friday, and it's completely confidential. Through my back window, just around the corner, you might see a little corner of one of our peer support volunteers who is answering the phone there. Next slide. So I think what we do is pretty unique because our phone is answered by peer support volunteers who are seniors who have had lots of training with us. And we are much more than directory assistance. We provide information on services, eligibility, how to connect to them. We truly answer calls about almost everything. Although we're not a crisis line, we do tend to provide a fair bit of emotional support and a listening ear. And as you can imagine, since our phone line is answered by seniors, seniors really appreciate the opportunity to speak to other seniors. In addition to information, we also provide navigation support, and I'll talk a bit more about that. We follow up with many of our callers. So if they give us permission, we'll follow up with them in a few days and say, did you manage to connect to that service? Is that what you needed? Although it's not with every call, sometimes the support we provide can continue for months if someone's in crisis and has a lot going on in their life. And in addition to supporting seniors, family members, unpaid caregivers, and service providers, we also help other community agencies and government departments. Next slide. So this is just some examples of the questions we receive. How do I make a will? Are there programs for people with COPD? I think I need home support. What is my first step? My friend is being abused by her son. How can I help her? I'm going to be evicted. What can I do? And unfortunately, more and more we're hearing, I can't afford food and I have bill collectors calling me, help. Next slide. So just to give you a sense of how busy we are, in our last fiscal year, we had 3,935 inquiries. And from those inquiries, we referred them to we made 3,808 referrals to services. And that was found in 369 programs in 188 agencies. Next slide. So one thing that we like to do is to analyze our calls and determine what seniors' needs are. And it's probably not a surprise, but the top two we have every year are daily living and housing. And I will say we also look at unmet needs, and we work closely with the provincial government to tell them what we're hearing from seniors and what are unmet needs so they can develop programs to address those. Next slide. So a little about those two categories of housing and daily living. Housing is strictly people looking for a place to live. So people might want to downsize. They might find that they're having trouble with maintenance. Their home is no longer accessible or no longer affordable. Daily living is really about the things that keep a senior at home. So those involve questions about things like home support, home maintenance, snow clearing, and I can tell you Newfoundland will get a lot of those calls. Emergency alert systems, so those are like personal alarms like Lifeline, and supportive case management, which would be connecting them with agencies that do things like help them read forms, take them out for banking, medical transportation, and that sort of thing. So next slide, please. But I do want to talk about the fact that services need to be accessible. So we have a database of information and of resources that we use to refer to services. And between government, community organizations, and businesses, we have 1,000+ resources in our database. But a service is only good to someone if they can access it. Quite often we find seniors are unaware of services or completely unaware that they're eligible for them. And more often than not, seniors can't access or actually connect to the service. It might be because of lack of transportation, no internet or computer, or they actually need some help to apply. Next slide. So I thought I'd give you just a few examples of how we help to make connections for seniors during COVID. So of course, when we first were locked down for COVID, trying to have groceries delivered was a huge issue. And we actually found that many of the seniors that we serve, who tend to be probably lower income seniors and who might not have technology, were really struggling. Many of them didn't have a credit card, so that was a huge barrier in trying to get groceries delivered. Many did not have the internet to pick out their groceries. So we and other community organizations got together to support them to do that. In fact, one other community agency actually bought groceries on their own credit card and then worked out the difference and allowed seniors to pay cash. We also found that a lot of the people that call us prefer to get checks in the mail as opposed to direct deposit of benefits. And there were postal delays at the beginning of COVID. So we helped a lot of people to sign up for direct deposits. Problem was that when you're calling Service Canada or CRA, especially during the early months of COVID, the lines were busy and they could be busy for hours and hours. Some of the seniors that call us have just cell phones with limited minutes, and they literally cannot stay online for more than 10 minutes. Otherwise, they won't have phone service for the rest of the month. So we also facilitated them to do that. Signing up for COVID vaccines. Again, there was a COVID vaccination line, but people would be on hold for hours. So we helped do that online. We printed out vaccine passports when our province brought them in. And today we still help with booking COVID tests and getting results online. Next slide. So I thought I'd just give a few quick examples. And one of them is on the importance of knowing options. So we had a lady, Allison, 82, who called our information line, and we have a housing list at senior apartments. She called looking for the list because she was considering selling her 2-story home. But after chatting further with Allison, our peer support volunteer learned that her main concern was that she was actually finding it hard to go up and down the stairs in her home. So our peer support volunteer told her about a home modification program that we have in Newfoundland that would allow her to make accessibility changes and also to get a stair lift. So we sent off both our housing list and the information on the program. And when we checked back with her in a few weeks, we found that she had successfully applied for the funding and she was going to stay in her own home. So again, it's really about knowing your options, and that can empower a senior. So next slide, please. And just one more. We had a gentleman, Henry, 67, who called our information line because he was in financial difficulty. He had stopped receiving his guaranteed income supplement payments, which are for low-income seniors, but it had been several months and he wasn't even sure who to call about this. This was a major drop in his income. And in our province, if you're eligible for the GIS, you're also eligible for a 65 plus prescription drug card. So losing his GIS meant that he had lost his medical prescription coverage as well. Now he was in real trouble paying his bills and could no longer afford his medications. So we were able to connect him with Service Canada, and thankfully there is a form that you can fill out so the government knows that, oh, sorry, I should backtrack. We asked him some questions about his situation, and we determined that what had happened is he had a very small RRSP that he had cashed in the previous year. So that actually bumped up his income, so he was no longer eligible for GIS. So by connecting him to Service Canada, we were able to fill a form that explained that it was a one-time increase in his income, get him reinstated on GIS, and the drug card reinstated as well. So that was something that was causing a crisis, and by being able to make a connection to the right agencies, it made all the difference in the world. Next slide. I just wanted to talk a little bit about how information is important to age-friendly communities. So age-friendly communities is something that the World Health Organization came up with in 2006. And they developed a guide to help communities become age-friendly. So an age-friendly community recognizes that seniors have a wide range of skills and abilities, understands and meet the age-related needs of seniors, must respect the decisions and lifestyle choices of seniors, protect those seniors who are vulnerable, recognize that seniors have a lot to offer in their community, and recognize how important it is to include seniors in all areas of community life. Next slide. So they say there's 8 key domains that must be addressed for a community to be age-friendly. And many of them are what you would expect: outdoor spaces and buildings, transportation, housing. But communication and information is one of the things that they point out. And I would argue that this probably underpins all other aspects of age-friendly, and having clear information is certainly a senior's right. Next slide. So just some thoughts as you move forward. As you provide, advocate, or access services for older adults, I hope you'll consider information, communication, and connection, and ask, are all seniors aware of this service? Do they understand how to access it? And do they have the tools to access it? Next slide. And if you answered no to any of these, I hope that you will provide or advocate for plain language, materials in a large font, multiple ways to learn about the service and access it. We find many of the seniors who don't have the internet here listen to the radio. The newspaper is still an important way for them to get information. Advocate for no wrong door systems. And if you're not familiar with that term, that means that if you go to one agency and they help you with one problem, but you also have another problem, they don't just shut the door on you. They actually make the referral for you and make sure you get to the right place and get connected to another service provider. And I do think we need to return to a customer service mentality and support for navigation. Human touch is very important. We need that human connection so people can connect with the services that they need. So thank you very much. And I've included my contact information as well.
Thank you very much, Elizabeth. That's really fascinating data that you're collecting. It'd be helpful. So I'm going to pass it back to Charlotte. Are you monitoring the chat and questions?
Yes, I am. So there's a question here for Bobbi, and I encourage others in the audience, if you haven't already, you can put your questions in the Q&A or the chat. I've seen a few questions in the chat as well, so I'll get to those. But Bobbi, the question is wondering if the programs you were speaking of are available to all BC seniors.
The programs are available. Thanks for that question too, by the way, Barbara. The programs are available to seniors in the communities that the programs reside. So of course, we don't cover from tip to tail of the entire province. As we spoke of with Better at Home, we're quickly expanding. We're in 260 some odd communities across the province. And so Better at Home services would be available to seniors within those communities that the programs serve, as with TAP, social prescribing, or any of the other programs. So it is limited, but at the same time, we continue to expand across the province. Thank you.
Wonderful. Pat, I see you have a question if you want to go ahead.
Here. In all the discussions that we've had, and this has got nothing to do with the Canadian Health Coalition. This is all about me. I want to know if anybody in any of the groups, and I'm particularly thinking about Elizabeth because she addressed it most closely, was something for seniors, like a way for seniors to discuss planning for the future. Because all of us, let me say, all of us sit around in our houses very comfortably, and we go off to wherever we go and we do things, and and then one day suddenly we can't do that anymore. For example, you might lose your driver's license, you might be suddenly in a situation of disability. I'm somewhat disabled at this point, but I could become more disabled as time goes on. And planning is something that, you know, most seniors are left to do on their own until they're in a crisis. And then it's something that somebody else has to intervene. So I'm wondering if any of the organizations, any of these folks have talked about or have something that would, you know, like a sort of a template for seniors to plan how they're going to live out, you know, the next decade, the next 20 years, whatever it might be.
An answer for SeniorsNL. So unfortunately, I don't know that if there's a one-stop shopping, but there are many things that we have. For instance, we have a housing transitions booklet. We do a lot of work with Public Legal Information Association in Newfoundland and Labrador and discuss advanced healthcare directives, which I think are called living wills in other provinces, power of attorney, wills. We also do a lot of work with a credit counseling organization in our province to talk about budgeting. But you know, your point is really right on. So I'll give you an example. For instance, 10 years ago, if you were going to go into long-term care, you would have to sell your house and they would take their money. So there was a lot of people who, when that changed, did not realize that changed. Now it just looks at your income. So people are still giving their house to relatives when they don't have to. It opens a lot of people up to elder abuse, and it's because they don't have the right information to make those kind of things. So for individual questions, we really do encourage people to talk to us. And there is a lot of hearsay about, you know, rules and regulations and stuff. So if people like that in Newfoundland have questions, absolutely, we will connect them to the right people.
Thank you.
Wonderful. Okay, we have another question. This is presumably for everybody, if people want to chime in. How can a community advocate for a Better at Home program?
Well, I guess I'll take that one first. We get this question a lot, so thank you, Audrey, for asking it. There are several different ways. One, talk to your MLA. You know, we say that all the time. Talk to those MLAs, let them know how valuable the Better at Home program is and how your community would really love to see it. But we also keep a wait list. So all of those communities that you saw earlier on one of the slides, for the most part, have reached out to us and have really advocated for their community to have Better at Home. So as we receive additional funding to expand across the province, we go back to that list, determine readiness. We do community development approach with consultations, determine, you know, which would be an eligible organization who could hold the program, but it's advocate through your MLA and connect with us within the program so we can add your community to the wait list.
Does anyone else wish to chime in on that one?
I think that was a pretty thorough answer. You know, it's a provincial, yeah, it's a provincial responsibility. So when you're looking for direct services like that, you go after your MLA and sometimes your you know, local, depending on what kind of services they provide. So I think she nailed it there.
I have a question for you, Margaret. I'm wondering if you have seen a shift in, you know, dialogue and people speaking about the rights of older people since the COVID pandemic began and, you know, is still ongoing. Have you seen a shift in what people are speaking about? I know you were working on these issues for quite some time before COVID. So I'm wondering what the shift in topics was and, you know, if people have it more on their radar now.
I think for sure it's more on people's radar. I think everyone, even though we knew there was problems in long-term care, I think it was pretty shocking to see what happened in Canada. And I remember when the Army went in Spain in early days of the pandemic thinking, boy, that's bad. And we also had been in conversation, you know, I usually look at national and international levels, but I happen to be on a program that looked at long-term care in Ontario, which is the province I live in. And they were telling us very early that they were terrified and that things could get quite bad. And, you know, they were right. And so we sort of stayed and watched that. A couple of things have happened. I still think that the response from governments has been far too tepid. And I think they're still not addressing this in the kinds of really holistic ways they need to look at it. So just to give you a quick example, when we're talking about direct services and whatnot, I'm a former bureaucrat. I was in the government as an executive in Public Health Agency of Canada, and I worked there for 31 years. There's a lot of policies that we steal from other countries. We have fabulous examples of the continuum of care in places like, you know, the classic one that everyone uses is Denmark, where they shifted a lot of the money from long-term care into home care. You can get up to 10 hours of home care in that country if you need it. And so a lot of people got to stay home and are getting the kind of care that they need to stay out of the system. And they still have long-term care in those situations where you need them. But I think we need to be looking at those kinds of things, particularly with what happened here. You know, and again, we have to think about what happened as a human rights violation because it keeps getting minimalized, and it is a human rights violation. We have the right to health. And the fact that the healthcare system isn't looking at anything other than acute care is a real issue for us. We need to be thinking about the continuum right across, and it should be equally important. So that's my speech on that.
Thank you.
Wonderful. I have another question here. This could be addressed by anybody, but with a shortage of, it's more maybe long-term care associated with a shortage of personal support workers, PSWs. I believe that's just the Ontario term. I'm not sure if it's universal across Canada, but with a shortage of PSWs already in long-term care and a shortage of registered nurses in Canada, how do you imagine the evolution of a continuum of care for seniors in the community moving forward across each province and territory, you know, viewing that we have all of these shortages for staff, and we can't meet needs in these facilities? How do you see us moving forward in Canada? Maybe in your specific province.
I'm happy to take it from a national perspective if you want. I think we know that we have to really work on pulling in immigrants who have those kinds of skills, and we have to stop making it terrible for them when they get here to actually do, you know, the work that they've been trained to do. So there's a whole issue on how we deal with the immigration system and how we bring people in so that they can, you know, work and fill these gaps. So that's a national perspective, but I'll let the provincial folks answer the provincial side.
I can say something just from the Newfoundland side. We're going through a really interesting process right now. We have something called Health Accord NL. It's really a whole reimagination of our health system. They did all sorts of consultations. They put out their plan. We're just waiting for the blueprints. And it's going to involve a lot of collaborative teams, reimagining how people work. We're moving from 4 health authorities to 1. We're getting collaborative medical teams. So I would just say stay tuned and watch us, because we're going to go through some really big changes in the next few years.
And I can comment from here in BC, although I don't have a solution to how do we get more nurses and PSWs here in the province. We do know there's a huge burden in hospitals, long-term care, assisted living. I mean, they're overwhelmed. And this is where the community-based services come in, is we're trying to work in collaboration with each other to try and ease some of that burden of responsibility. So as an example, with our social prescribing program, we're piloting in a few different communities in some of our health authorities, where our community connector becomes part of the discharge process for release from hospital. So we're being able to release some of those beds where you have seniors that are in those beds for weeks on end because they have no ability to go home. They don't have family and friends. So by connecting them and including the community connector as part of the discharge process, that individual knows 2 weeks out, this person's going to be discharged on this date. So let's make sure that we have transportation. Let's get some light housekeeping in there. They haven't been at home for 3 to 6 months and nobody's been in there. Let's air the place out and give it a good dusting and vacuum. Let's make sure that there's basic groceries in the refrigerator before they get home. So milk and bread. And we can also get them their prescriptions on the way home and set up a connection to ensure that home and community care is going to be there to connect with them. And so that's sort of the role that community connectors plays to, to join the whole section and give that wraparound services to that individual.
Gregor, would you like to go ahead and jump in?
Just a brief comment from some, personal experiences. I think there's also opportunity to strong opportunity and need to relook at how the health services sector are being compensated in terms of nurses, RPNs, PSWs. I know so many there just paid an incredibly low wage, and at least in Ontario, the system is set up so that organizations, hospitals, and so on they only hire on a part-time basis. So it's part-time, so they don't have to pay benefits. You're not paid your sick leave. You can't come in if you have a sniffle or your child has a sniffle. You can't get vacation time because you're an essential worker. It's just awful. I know so many people have quit their jobs or are recruiters and have such a hard time finding employees because the pay and the benefits are just not in keeping with what's demanded and asked of them. Our heroes. We really need to compensate that properly and make it an attractive role, an attractive position to be passionate and care for, because a lot of these folks are passionate, self-giving, amazing people that are in the care profession, and we just don't treat them well. So it's an opportunity there as well.
Okay, thank you. Charlotte, back to you for questions.
Yeah, certainly. And I'm happy you mentioned that, Gregor, because, it is a human rights issue on both ends, right? With residents, but also the workers in these facilities, right? We need to have decent working conditions and fair wages. So that's a whole other piece of the puzzle. There's a question about the difficulty LGBT seniors, including those of color, that who may find it difficult to find welcoming long-term caregivers or facilities And this person is wondering if anyone can speak to that, maybe, some new initiatives about welcoming and inclusive facilities. I actually just saw maybe last week or the week before, it's not LGBT, but it's people of color. The first Afro-Caribbean long-term care center is going to be opened in, I believe, Durham region. So if anybody has any thoughts on the difficulties LGBT seniors and maybe those of color may find in welcoming and inclusive facilities or caregivers themselves.
And part of that is a training issue. We need to, when we were training workers, to make them to understand, first of all, when you choose them, that they have empathy and understanding, because we are talking a lot of times with older people, multiple isms, sexism and, anti-gay or homophobic or, anti-LGBTQ. So those are areas we know we need to focus on, and that should be a really crucial part of any kind of training for people who will go out into the community and support, and in fact, those in hospitals as well.
Thank you.
There's a question here about, which maybe Pat, you can speak to this as well, so please do jump in. How can we stop the privatization of long-term care and community care, especially, in Ontario, we've seen that this is a pattern. So how do we advocate for this not to happen?
Vote.
Yeah, I think that I think that just being active and advocating on behalf of our healthcare system, whether that's in terms of long-term care or generally, and of course in British Columbia, that's been an issue for a few years now with the Dr. Day situation. But if we want to protect our healthcare system and we want to have long-term care included within that, anyone who is an activist has to be able to raise their voice at any time possible. And again, I raised my hand because I wanted to get back into this issue of planning. It's not good enough when you get into a crisis point where, holy shit, I can't live in my house anymore. I can't, I don't know what to do anymore. I need to, I need to move into some other situation. When we're still okay to do this, there somebody or some organizations, and I don't know who that is. It's probably not the Canadian Health Coalition, because we are a political organization and that advocates for the inclusion of long-term care into the public healthcare system and other things as well. But in terms of people who advocate simply for seniors, that there is a way that we can plan, that us as individuals and as groups can get together and plan how we manage our lives going forward, because this demographic of people like myself, aging baby boomers, we've displayed a lot of skills over the years, but planning is not always one of them. Planning is something that you do when you find yourself in a crisis, and I think that some thinking in terms of academia and advocacy groups should think about how do we plan for our aging process? How do we do that? And that's something I think all you guys should put your brains to if you can. I will continue to raise it in the forums that I'm involved in. But I think that the planning for our future is really critical, and that will involve every one of us who are interested in this issue.
Margaret, would you like to jump in on this topic? Or?
Sure. I think it's absolutely Pat's bringing up a vital point. We need to plan, and I'm a 63-year-old. I need to be starting to think about these things too. But I think there's two sides to that coin. There's the importance of planning and having some support in terms of structuring, but you need the infrastructure to help you so that your plan actually works. So having a long-term care system that works and a home care system that works is absolutely vital for planning. And for someone like me, who I want to stay in my home like most seniors do, I want to be thinking about how that can happen. Well, if you don't have if you're not screaming rich, you need to be looking at the infrastructure in your communities and in your provinces. And if they don't exist and they can't support you, you got a problem. And that's what's happening right now. We're pole vaulting people into long-term care who could probably stay in their homes longer because we haven't funded that system. So part of this is an advocacy issue, which links back a bit to Pat's planning, is that we need to make sure that we are, kind of like I said at the end of the speech, voting, talking, yelling, making sure that people are hearing that we need to fix the system so that we can plan and make decisions about our future that can actually be actualized. So I guess that would be my 2 cents worth, but I agree with Pat. I better go plan right after this meeting.
I just wanted to chime in here too, because I agree with you wholeheartedly, Margaret. You need the infrastructure, but sometimes it's baby steps too. And at that most basic level, providing simple tools for older adults to really consider, like, here's a little booklet that I can sit down with my daughter or my son so that they know where my will is. They know what my accounts are. Like, they get stuff in order so that they feel a little bit more confident. And so we've created some of those books, mostly with our family and friend caregiver programs. We've got these great books that are really designed for that caregiver to give them a sense of, I know what this individual wants and needs as we move forward. But I'm also really thrilled to hear about programs like what Gregor has about home modification. So thinking about your own home as you move forward, what will I need to do if this happens? And just as a personal story, I bought a house 12 years ago with a suite in it that was ground level so my parents could move in. So, it was that sort of, not everybody has a family that will do that, but I'm so glad that I did it because over the last couple of years, my father lost both of his legs. And my mom had to quit her job to become a full-time care provider. And now we're all in the home supporting each other. But I was really glad that I was able to have the opportunity to move them into my home. I had the forethought to get a home that was ground level, so there were no stairs. We widened the doors. We swapped out the bathtub to a walk-in shower. But all of these things became huge for us. So we were prepared for when he did lose his legs 12 years ago. We had no idea that was going to happen. We were a bit more prepared moving forward. And I think it's having webinars, having education sessions, holding types of forums where we can sort of start to get people thinking, what if, as they move forward.
If I could just chip in Cowichan, we have a group called EPIC, which is the Elder Care Project in Cowichan, and we've done work on helping people identify their frailties or how they are aging, what to do about transportation as you age. And the other one is advanced planning. And in collaboration with our hospice people, we have put together a course that can be taken. It's free, and it's 3 hours over 1 day, 3 hours over 2 weeks. And it really goes into all of the planning, not only the medical, but the social and the housing and the rest of it. So you might want to see if there is an organization in your home territory that does have that kind of education, this access to them, without incurring large legal fees. I'm seeing in the chat that there was a comment that having a seniors advocate, nonpartisan in Ontario would be helping elder rights, and they're wondering about opinions. And I could just say that is one of the things that the working group in CFUW is beginning to advocate for, is to have a seniors advocate that is not linked to government, but separate in every province. At this point in time, we only have two, one in Nova Scotia and one in BC. So thoughts from our panelists?
I'll just say that Newfoundland does have a seniors advocate as well. At the moment, the role is vacant. We're just waiting for a new one to come in. And for the last seniors advocate, one of her big projects was examining long-term care, and we're really hoping the next seniors advocate will do it. And I think it does truly make a difference to have, as you said, someone who's separate from government. Our seniors advocate looks at systemic issues. I think there's also a role perhaps for seniors who are maybe more of an ombudsman and helping with individual issues as well. But definitely the role has done some good in Newfoundland and Labrador, and I would encourage other provinces to do the same.
Thank you for that.
I'd say it's vital. It's absolutely vital. I think it should be in any province, and there should be a national one as well. So I think there's a
national coalition of all the advocates so that they're connected.
Well, and one who is watching what the federal government's doing as well.
Yeah, I just would throw in there that we do have Laura Tamlin Watson CanAge, who is a national senior advocate and does do work in provinces as well. So that's a good place to start if you're in need of assistance or support in that area. www.canage.ca.
Okay.
Her and Margaret get up to all kinds of trouble just so that
you
know.
Call Laura, get your problem solved and get in trouble.
I'm curious if anybody is, the sort of the high profile seniors groups that are around, and I've sort of lost their name right away, but I wish I could remember it. That used to be headed by Susan Ing.
That's CARP.
CARP, yeah, that's right. I wonder, do people have any opinion about CARP's role in any of this, or whether they're useful, or is that, it seems to me that they're pretty much focused on fairly well-to-do, upper middle class kind of, seniors, couples, it's, people that aren't already in crisis or lower income. I don't know if anybody has any opinions about that. I mean, when I think about seniors planning, I'm not thinking about, people in the sort of in the upper middle class. I'm thinking about people who are, who are likely to be in crisis if they don't get involved sooner, or if they aren't approached sooner to be involved in their own future. It's just a whim. I just wondered if anybody thought about that.
I think all of the major seniors organizations need to start working together, not just CARP, but there's a number of them. The big pensioners organizations, so Laura Tamlin Watts, myself, Gregor, and others, we've started conversations on this, and we're starting to look at ways to really work together to start to push for change, because I don't think it is one. It has to be many. And it has to, we have to have ways to get into membership organizations, so that we can get to voters and start to pass down messages. So there's a lot of work to be done on that. And I think the pandemic has sort of pushed the issue forward. And just one other quick question connected to Gregor's comment earlier about workers and how workers are treated. As a CFUW and a group that looks at women's issues, there is a lot of what happened here that are women's issues. Women make up the majority of people in long-term care, and the majority of workers who are, who were put in the front line of the pandemic with absolutely no support, no PPE, moving from place to place because they had to, getting sick, and then being blamed for spreading it because they were forced to work in different places. Those are all really key women's issues, and I think we need to be thinking of that also as we start to advocate for changes in the system. Just a side comment.
Totally.
And just having just what happened in the States.
Yep, totally.
Charlotte, anything in the question and answer section that you're looking at?
I'm seeing some, there's a request, Margaret, if you could post or maybe in the chat some of the resources you mentioned connecting to the UN, possibly specifically, if you have any, you know,
Sure.
of that on your website.
It's all on my website. But maybe the easiest thing for me to do is just have a little think, because I've got things that, if you don't know my website, like arguments for and against the convention. Once we start working with the other NGOs, national and NGOs on aging, I think we're probably going to be doing a writing campaign, probably around long-term care and also around, well, continuum of care, frankly, and then also around the convention and human rights. So that's probably going to be coming up. But maybe what I could do, it might be easier if I perhaps send it to you afterwards, Charlotte, and if you want to share it with the participants, if that's of interest to you, would that work?
Wonderful, that sounds great. And that goes for all of the speakers and our sponsors as well. If you have follow-up material, I will definitely be happy to send that out to all the folks who registered, because I know we had well over 200 registrants. A lot of folks just sign up so they can get the recording later on. So I think it would be fantastic to have a bunch of follow-up materials for people to peruse after they've watched the recording. So that would be fantastic. Wonderful.
And that all of that information will be shared with the group that I have nationally, the CFUW group on elder rights and long-term care.
Sounds good.
Perfect. I think we are towards the end of our session here. Sheila, if you'd like to wrap us up and provide some final remarks.
That with great pleasure. I'd like to once again thank the Ontario Health Coalition and the Canadian Health Coalition. Pat Van Horn, thank you very much for being here and being a participant as well as a sponsor. And Gregor, the same to you. We've enjoyed your input and thank you for your generosity in the sponsoring. And to our speakers, our panelists, fabulous job. The information that you've imparted has been invaluable, and I for one, have my mind going in 6 directions at once, trying to figure out which step we take next. So Margaret, Elizabeth, Bobbi, and Kahir, thank you so much for your participation today, and to all of those who joined us from across the nation to have this town hall meeting today. Thank you for your interest. Thank you for your presentations, and to all a good rest of your day. Thank you for attending.